This is the floor plan of a call center in Seoul, South Korea, with an outbreak of the coronavirus. We showed you this plan before. It's an open office setting, which very familiar to all of us now, since everything's an open office setting. Got long rows of shared desks there at the top. The people that are sitting at those desks are talking loudly all the time. Those clusters of blue patches are seating places of people who ended up getting the virus. And you can see how quickly it spread in that call center, particularly up the top there with those long rows of people all sitting next to each other. Of course, the problem is a lot of offices look kind of like this. I mean, which basically makes them a very serious public health problem right now. So how exactly is the office going to work as an institution in the era of the coronavirus? Surgeon and public health researcher Atul Gawande looks at exactly this in his latest piece for The New Yorker. Quote, American hospitals have learned how to avoid becoming sites of spread. When the time is right to lighten up on the lockdown and bring people back to work, there are wider lessons to be learned from places that never locked down in the first place. And Atul Gawande, staff writer at The New Yorker, joins me now. Maybe, Dr. Gawande, you can start with what you think we can learn from a place like a hospital in terms of the best practices for other workplaces.
Well, hospitals are places where people have been going to work throughout the pandemic, including in places like Boston and New York, where we were hotspots for spread, and yet our hospitals did not become those sites for spread. So how did we do that? It boiled down to, sort of a learning process, but we found there are four things that you put them together. Each of them are imperfect, but you put them together and they worked. All of them are familiar to us. They are hygiene, so that's hand washing and disinfection. That is distancing, and we can talk about what's required to pull off the distancing in a office setting. The third is masks, and I think we're all learning how to take those really seriously. It's I protect you, you protect me when I wear a mask. And then finally, the one I don't think we're taking seriously enough is that every day that I go to work at the hospital, I get screened for whether I have any symptoms. I have to attest whether I have a sore throat, sniffles, you name it. And if I do have those, then I stay home and I get testing. If I don't, then I can go into work. And that last part, we're not taking seriously yet the idea that our symptoms really matter and we shouldn't be going to work or circulating when we have symptoms.
Let's say more about that, because it does seem to me that there's been this kind of back and forth on that question in terms of containment, right? So we saw all these news reports about places that had these infrared temperature cameras affixed to them, and as a means of trying to sort of stop the spread. And then there was all this reporting about asymptomatic transmission, and I think some people said, well, then the temperature checks don't matter. What you're saying is symptoms really still do matter, and they're part of the checklist.
Yes. So as I said, none of these are perfect, right? You are correct. 40 to possibly 50% of spread occurs before people have symptoms, but the majority happens while people have symptoms. And masks are a great protection, but they are not perfect. So the combination of making sure that you are not turning up in circulation, you've got symptoms, is the problem. I'll give an example. In Missouri, two hairdressers, we heard about it, at Great Cuts, had 8 days of symptoms and ended up exposing 140 customers plus their coworkers. Now, everybody was wearing masks, so we're going to be really hopeful that over 8 days they did not spread to other people. But we know that masks may contain your spread when you're talking, when you're coughing, when you're sneezing, but it's not perfect. There's air pockets all around, and in a closed space like in a salon, you can be passing virus into the air that then gets inhaled by other people. So I'm going to be hoping very much that the findings for those 140 people are going to be negative, but that is not the way to be successful. Places that did not add screening in the hospital sector have had spread. And so it's the combination of all these things.
So let's talk about spacing, to me, which seems in some ways kind of the hardest nut to crack, right? So you can habituate people to hygiene, you can do disinfecting. There's the sort of policy question of whether employers can get access to tests, but they can do symptom screening. Spaces, look, particularly in expensive metro areas, whether it's downtown Atlanta or Los Angeles or New York or Boston, right? Like, no one's got a lot of space that's just hanging around. the office space is optimized for the amount of people who, in the sort of open office plan revolution, are basically now all sitting on top of each other, like talking in each other's face for the last 15 years. And I'm just not sure how you create enough space under those kind of like physical and design constraints of the office as currently extant.
Yeah, I mean, what we've done in my hospital system is have to really reinvent almost everything. You know, our conference rooms are largely cordoned off. We do meetings through Zoom even when we're at work. We will, and when we're in a meeting room, we will remove every other seat to make sure everybody's 6 feet apart. We will think hard about how long the meeting is, because every extra 10 minutes you add is extra time of exposure. Now, what we also know is if you have a mask, then you're minimizing the likelihood of spread beyond 6 feet. And so the combination of a mask and distancing is likely to be highly effective. Then you add in, you know, and we're putting up plexiglass like many places. And we've discovered that a lot of the work doesn't have to be there, right? My clinic is largely virtual now. I mostly see my patients through Zoom. Now, obviously, surgery, I'm a surgeon, that part is still right there on site, but we're limiting how many visitors come in and all of those considerations. And those are all the things that that will happen in our workplaces, and is already happening for essential workers who turn up for work every day.
You know, that to me is sort of the profound question here about the sort of structure of a certain segment of the population's work life, right? We're not talking about people that are in service sectors or, you know, working in a GM factory, although there's lots of things being done in those factories, right? There's lots of things being done in every workplace. But for the office worker particularly, like if what's on the other side is, oh, half the workforce can come in, wear masks all day, be in plexiglass, and do the meetings on Zoom anyway. It's like, why are we bringing it at all? I'm just not quite like that. To me, is the big question.
Completely. We are all discovering that a lot of the work can be done perfectly productively without us turning up for days on end. We may find that we're shifting, you know, in the hospital setting, there's lots of the care, the direct patient care, where you have to get within 6 feet.
Of course.
I find, even though we're all spaced out, that the same kind of spontaneous run into one person, have an exchange, and then continue onward, that's still really important and is there. And I suspect we're going to discover that it's not all completely replaceable. That said, is it going to be a situation where we turn up one day out of the week to plug in and there's a rotating roster of people who come so that it's not full all the time? All of those things are things that we've done. We have 75,000 people who show up for work in my healthcare system. It's more than 3/4 of the counties in the United States. And 50,000 of us showed up in the last 4 weeks, but not everybody every day. And we're finding ways to create that spacing in the healthcare system.
Atul Gawande, who is always just a fantastic read on the intersection of anything having to do with healthcare and our society more broadly. Thank you so much for making time tonight.
Thank you, Chris.